Right, ladies and gentlemen, today the topic of discussion is squamous cell carcinoma. We'll talk about cutaneous squamous cell carcinoma. For now, squamous cell carcinoma can be identified, can involve a variety of sites. However, today, for the purpose of discussion and this practical, we'll talk about cutaneous squamous cell carcinoma and discuss morphology according to that. Now, squamous cell carcinoma, skin, is the second most common tumor. Uh, Now, we also talked about the areas of involvement in basal cell carcinoma, similar areas of involvement. So, squamous cell carcinoma can involve similar sites, generally at sun exposed sites. Now, sun exposure is very important with respect to squamous cell carcinoma. It can be face, it can be scalp, it can be feet, anywhere, any region of the body which is exposed to skin, and usually in older um, people. Um, Higher incidence in men, except for lesions on lower legs. Now, why sun exposure plays an important role is because of this that the UV rays, they cause DNA damage and result in a few mutations. Um, there are different TP53 commonly, um, and what can happen in a second scenario is that the patient is immunosuppressed and there's a history of infections. Now, so a patient without a history of immunosuppression, without any history of chemotherapy, any other cancer, HIV, etc., the most important cause is this exposure to UV light. But those individuals which have a history of immunosuppression of any sort, um, infections can actually contribute. The most common one you'll hear about with respect to squamous cell carcinoma is HPV, the human papilloma virus. Okay, how do these lesions present? The superficial lesions generally presents as plaques, as scaling plaques, as gray scaly plaques. And if the lesion is advanced, if lesion is detected or seen at a advanced stage, at a late stage, the lesion, it can look like a nodule or an ulcerated area. Now this is the histology. We'll see discuss it in with the help of photomicrograph. Now here how it looks like. Here's how it looks like on gross or clinically. You can see we talked about a scaly plaque, but that was about a early lesion. This appears to be an advanced lesion. You can see the surface. There is kind of a scale here as well, but it has sort of ulcerated too. So this is the surface boundary of the lesion. We don't know the depth of the lesion yet, but it's determined on histology. But this is the classical. You can see this is scalp of patient. This is a sun exposed site. Must have been exposed to UV, a lot of UV rays, and here it is. Now, uh, when we look at the histology, there are very specific points with respect to histology of a squamous cell carcinoma. Here, the picture I'm pointing right now, you can see on the surface. Just try to remind yourselves of the normal histology of skin, uh, the different layers. This is the surface of skin. You can see here in this area, a problem started developing. Now, The tumor started here, and these all are the invasive tumor cells which you see in the underlying areas. So this part is still almost normal, and here we can see the invasive tumor cells on low power. This is how it looks like on a high power examination. Uh, they are classically described to have nests or sheets depending upon differentiation, depending upon degree of differentiation. Uh, they're described as having nests or sheets of polygonal cells with eosinophilic cytoplasm. Now you can see here that there are this cell is a separate cell, this is a separate cell. They have different shapes, so they are described as having a polygonal shape. You concentrate on this cell, you can see this is the nucleus, this is the cytoplasm, and here inside the nucleus is a prominent nucleus. So we come to another feature, that is a prominent nucleus. And then there is a very important feature as well. You can see here that there are intercellular bridges. You can see these fine threads that are stretching from this cell to this cell, from this to this. Here, these are fine threads. So these are intercellular bridges. So generally remember that squamous cell carcinoma shows nests or sheets of polygonal cells with eosinophilic cytoplasm, nuclei with prominent nuclei, and you may see some intercellular bridges as well. In the next picture, we see another important feature, which is known as the keratin pearls. You can see here in this area, this structure is known as the keratin pearl. This is a whirling area. You can see the cells are whirling around the central keratin. So remember the word keratin pearls as well. This area is showing keratin pearl formation. Here you can see more clearly the on this second picture you can see more clearly the eosinophilic cytoplasm. Again, there are polygonal cells. They have eosinophilic cytoplasm, and this cell shows prominent nucleus. Here you see a mitotic figure as well. So this is briefly regarding the histology and clinical presentation of a squamous cell carcinoma. I tried to explain it as concisely as possible. This is it for now. Please let me know if you have any questions regarding this topic. Thank you.